Good afternoon, everybody, and thank you for allowing me to present on behalf of all the EVEREST 2 investigators the one-year outcome of the non-high-risk arm of the EVEREST 2 REALISM Continuous Access Registry. The background is that this is a prospective multi-centered continuous access registry designed to evaluate the role of the mitral clip in a real-world situation. And you can see there was two arms of the study, the high-risk arm and the non-high-risk arm. The high-risk arm basically was people where patients had an estimated or calculated mortality at 30 days to be 12% or more, and the rest of the patients were basically the non-high-risk arm. For the presentation today, we're actually going to show you the one-year outcome of the non-high-risk arm. Patients in this study were first screened for their high-risk status. If they did not fulfill the high-risk status, then they were considered to be non-high-risk. They all had to have an MR to be 3+ or 4+ more, which was then clarified by the core lab. There were clinical measures that were assessed at baseline, 30 days, 6 months, and 1 year. And the important things that we did collect was MR severity, functional class, LV volumes, and quality of life. If you look at this chart, it actually shows you the clinical follow-up of these patients. And you can see the total number of patients in this category was 271. 32% of these patients were functional MR, and the rest, which is the majority, 70%, was degenerative MR. And you can see there was over 90% available follow-up at 1 year. If we look at the baseline characteristics of these patients, this slide shows you that these patients were quite elderly. They were over about 72 years in both categories. And this is important to recognize that the age was slightly higher than actually the EVEREST 2 randomized study. A significant portion of these patients actually had coronary artery disease, and a lot of patients actually had moderate to severe renal dysfunction. Really, regarding the procedure success, this is quite impressive. You can see that the procedure success as well as the implant success was quite high. In fact, 97% of people actually had a successful implant, and most of the patients were discharged home after a procedure, and the actual average hospitalization was about 2.9 days. The major adverse events adjudicated at 1 year are the following. You can see the death rate was 11% in the functional MR group, about 9.7% in the DMR group, which is essentially equal. The stroke rate was about 5% totally in 1 year, and most of them did not develop persistent or new atrial fibrillation. Device safety is, of course, a major issue that we looked at baseline as well as 1 year. And you can see over here that single leaflet detachment was about 2.4% in the functional MR group and was slightly higher as expected in the degenerative group. What is very impressive to notice that there's no case of mitral valve stenosis and no case of device embolization. This slide shows you the Kaplan-Meier estimates of freedom from death. And you can see over here that 98% were alive at 30 days, and survival at 1 year was 90% in both the groups. The next slide actually shows you the freedom from death in comparison to the EVEREST 2 randomized clinical trial. And you can see over here, when you compare the data, it's almost similar, that the 30-day mortality as well as the 1 year mortality is the same, but basically considering these patients are a much sicker group of patients. The Kaplan-Meier estimates of freedom from surgery is shown in this slide. And you can see over here, this is an important difference. The blue line represents the EVEREST 2 randomized clinical trial arm. And you can see those patients who were randomized to the device, 23% of these patients actually had surgery within the first year. On the other hand, if you actually look at the REALISM non-high-risk arm, only 10% required surgery in the next year. The MR severity, as expected, was improved at 1 year in both the groups of patients, functional as well as degenerative. And you can see 95% of people in the functional MR group had an MR grade of 2+ or less, and 80% in the DMR group. In the functional class, improvement was pretty dramatic, with 90% of people with NYHA 2 or less at 1 year. The core lab adjudicated volumes are shown in this slide, and this shows you that with the associated MR reduction, there was also a reduction of both end systolic and end diastolic volumes both in the functional group as well as the DMR group. And the quality of life indices are similarly improved in both the functional and DMR group, both in the physical components as well as the mental components. So we therefore conclude that patients in the non-high-risk arm of the EVEREST-2 realism were slightly more older and had more comorbidities compared to the EVEREST-2 randomized arm studies. There was a high device implant rate and a very low major adverse event rate at 30 days. When you look at the results over 1 year, there was a persistent reduction of MR with significant improvement in LV reverse modeling. There was an improvement of functional class. There was improvement of quality of life. And most important, there was a very low rate of requirement of open heart surgery in that 1 year follow-up. Thank you very much.